I still see people today that consume very little to zero carbohydrates a day, and they go about their usual everyday routine. Is this sustainable? No. The reason why people lose so much weight when they go cut out their carbohydrates from their diets, like that Atkins diet, it was really popular about 10, 15 years ago, and it still kind of lingers still today. Well, in the induction phase, which is the beginning of the diet, you cut out all carbohydrates. So when you cut out all carbohydrates, you drain all your body of the glycogen, right? And all the water that was inside. And people can lose around 10, 15, 20 pounds of water, seriously. And they go into this something called ketosis. Ketosis is where you burn fat inefficiently, so you tend to burn more fat. And that's okay, but again, your brain needs about 100 grams of carbs just a day just to be able to think clearly. So when people drop it under 100 grams, I mean, you'll have trouble thinking and remembering things, and you become spacey and sometimes irritable. It's not a cool way to be living. But however, you know, bodybuilders do this on purpose. I teach them because I teach them, you know, obviously we have a plan and strategy, and we practice technique like weeks out before a show. So what happens is we drain out all the water and then we shove it back in with glucose and glycogen so they're full, and it gives more of a dramatic effect. So we'll choose a week, many months out from the show, and we deplete with carbs for 5 days, and then you'll start loading up for 2 days, and then you'll cut water out. So what happens, so what we're doing when you're loading, you're shoving all this glycogen back in your muscle cells, and when you stop drinking water, all that water between your skin and your muscles get sucked into those muscles, and you look ripped and shredded and full of muscle, right? But if you eat too many carbs, you spill over, what they call it, and you look smooth on stage. If you didn't eat enough, you look flat, okay? However, the other dangerous problem is if you're not a bodybuilder, you're just doing this because you're overweight, and this especially happens to the people who are obese. And remember, they got to being obese from overeating for many years, so it's certainly a psychological trait. You can't get to be 300 pounds by eating normal. So they go on this Atkins diet where they cut out all their carbs, and they do this for about 3 weeks. By the 4th week, they're looking at that chocolate, cake, or pizza with love and affection, and eventually they're going to say, you know what, forget this. I can't resist this no longer, and they're going to end up eating the whole cake or pizza eventually. So they eat the whole pizza with all those carbs, and what happens is their body will start to overcompensate, and instead of putting one molecule and 3 times the amount of glycogen, like I just mentioned earlier, it still has to remain that ratio. So now it puts in 9 times, okay, the amount of water in the cell. So the muscle cells will get bigger and bigger until they can't hold water anymore, and they'll actually tear, and water spills over. When water spills over, it's called third spacing. Name a muscle in your body that cannot afford water and tears in it. Your heart. And that's why people that were on the Atkins diet, they go on this high amounts of carbohydrates, and possibly they died. And you know, there were cases that people died of a heart attack. So if you're doing it, if you're going to do this, you need to make sure to be coached to slowly increase carbs back into your diet. My advice would be to add about 25 grams of carbohydrates a week. So they go from 0 carbs to the next week, add 25, and then the second week, add another 25. So you got a total of 50, and the third week will be 75, and reassess to see how they're feeling, and then maybe go back up to 100. And this is safe. However, bodybuilders do this on purpose because they know what they're doing, and most of the time know how much exactly they need.